Approved uses. Jemperli is a prescription medicine used to treat adults with a kind of uterine cancer called endometrial cancer, EC. Jemperli may be used in combination with the chemotherapy medicines carboplatin and paclitaxel. And then after that, Jemperli may be used alone, when your cancer has spread outside your uterus, advanced, or your cancer has returned. Jemperli may be used alone when a laboratory test shows that your tumor is mismatch repair deficient, DMMR, and your cancer has returned or it has spread, advanced EC, and you have received chemotherapy that contains platinum and it did not work or is no longer working, and your cancer cannot be treated by surgery or radiation. It is not known if Jemperli is safe and effective in children. Important safety information. Jemperli is a medicine that may treat certain cancers by working with your immune system. Jemperli can cause your immune system to attack normal organs and tissues in any area of your body and can affect the way they work. These problems can sometimes become severe or life-threatening and can lead to death. You can have more than one of these problems at the same time. These problems may happen anytime during treatment or even after your treatment has ended.
Please continue watching for additional important safety information later in this video. Please see full prescribing information, including medication guide for patients, at adjacent links on this page or visit jemperli.com. I knew something was wrong. I was searching high and low for answers about my abnormal spotting and pelvic pain, but I wasn't finding any. I felt like I wasn't being heard. I felt invisible. Finally, I got my answer, and it was devastating. Cancer. Endometrial cancer. Stage 3. Once I got diagnosed, everything moved so fast. I felt lost. There was so much information, things I'd never known, words I'd never heard before. I barely had time to register that I had cancer. I felt overwhelmed. People around me didn't know what to do. I knew my family and friends wanted to help, but they didn't know how. I didn't realize that having advanced endometrial cancer would make me feel so isolated. It's like I'm not myself anymore. Or worse, that I'm just my diagnosis. But tomorrow is a new day. I'm starting chemotherapy along with another treatment, an immunotherapy that may work with my body to help fight cancer. I'm going to let myself have hope that it may help me. I couldn't do this without my care team, and I couldn't do this without my daughter Tina either. They helped me feel confident as I started my treatment with the immunotherapy Jemperli in combination with carboplatin and paclitaxel. I felt like I had a good idea of what to expect when it came to the dosing schedule and possible side effects. Tina has been my rock. She stays in contact with my care team to keep my healthcare visits and infusion appointments on track. She also reminds me to celebrate the good things in life. Tina is already talking about attending my grandson's graduation. I know nothing is certain, but hopefully I can watch him cross that stage. Endometrial cancer is scary, but I found a care team I trust and an endometrial cancer community that supports me. With Jemperli, I found a treatment option that is right for me. My road hasn't been easy, but I realize I have an inner strength I didn't know I had. And every day, I'm finding more of me. This is my Jemperli journey.
Call or see your healthcare provider, HCP, right away if you develop any new or worsening signs or symptoms, including lung problems. Signs and symptoms may include cough, shortness of breath, or chest pain. Intestinal problems. Signs and symptoms may include diarrhea or more bowel movements than usual, stools that are black, tarry, sticky, or have blood or mucus, or severe stomach area, abdomen pain or tenderness. Liver problems. Signs and symptoms may include yellowing of your skin or the whites of your eyes, severe nausea or vomiting, pain on the right side of your stomach area, abdomen, dark urine, tea-colored, or bleeding or bruising more easily than usual. Hormone gland problems. Signs and symptoms may include headaches that will not go away or unusual headaches, eye sensitivity to light, eye problems, rapid heartbeat, increased sweating, extreme tiredness, weight gain or weight loss, feeling more hungry or thirsty than usual, urinating more often than usual, hair loss, feeling cold, constipation, your voice gets deeper, dizziness or fainting, changes in mood or behavior such as decreased sex drive, irritability, or forgetfulness. Kidney problems. Signs and symptoms may include change in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Skin problems. Signs and symptoms may include rash, itching, skin blistering or peeling, swollen lymph nodes, painful sores or ulcers in your mouth or in your nose, throat, or genital area, fever or flu-like symptoms. Problems can also happen in other organs and tissues. These are not all of the signs and symptoms of immune system problems that can happen with Jemperli. Call or see your HCP right away for any new or worse signs or symptoms. Signs and symptoms may include chest pain, irregular heartbeat, shortness of breath, swelling of ankles, confusion, sleepiness, memory problems, changes in mood or behavior, stiff neck, balance problems, tingling or numbness of the arms or legs, double vision, blurry vision, sensitivity to light, eye pain, changes in eyesight, persistent or severe muscle pain or weakness, muscle cramps, low red blood cells, bruising. Infusion reactions that can sometimes be severe or life-threatening. Signs and symptoms of infusion reactions may include chills or shaking, itching or rash, flushing, shortness of breath or wheezing, dizziness, feel like passing out, fever, back or neck pain. Rejection of a transplanted organ. Your HCP should tell you what signs and symptoms you should report and monitor you, depending on the type of organ transplant that you have had. Complications, including graft versus host disease, GVHD, in people who have received a bone marrow stem cell transplant that uses donor stem cells, allogeneic. These complications can be serious and can lead to death. These complications may happen if you underwent transplantation either before or after being treated with Jemperli. Your HCP will monitor you for these complications. Getting medical treatment right away may help keep these problems from becoming more serious. Your HCP will check you for these problems during treatment with Jemperli and may treat you with corticosteroid or hormone replacement medicines. If you have severe side effects, your HCP may also need to delay or completely stop treatment with Jemperli. Before receiving Jemperli, tell your HCP about all of your medical conditions, including immune system problems such as Crohn's disease, ulcerative colitis, or lupus. Received an organ transplant, have received or plan to receive a stem cell transplant that uses donor stem cells, allogeneic, have received radiation treatment to your chest area, have a condition that affects your nervous system, such as myasthenia gravis or Guillain-Barré syndrome. If you are pregnant or plan to become pregnant, tell your HCP. Jemperli can harm your unborn baby. If you are able to become pregnant, your HCP will give you a pregnancy test before you start treatment. Use an effective birth control method during treatment and for 4 months after your last dose of Jemperli. Tell your HCP right away if you become pregnant or think you may be pregnant during treatment with Jemperli. If you are breastfeeding or plan to breastfeed, tell your HCP. It is not known if Jemperli passes into your breast milk. Do not breastfeed during treatment with Jemperli and for 4 months after your last dose. Tell your HCP about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Jemperli when given with carboplatin and paclitaxel include nerve problems in your arms, hands, legs, and feet, tiredness, nausea, hair loss, joint pain, rash, constipation, diarrhea, stomach area, abdomen pain, shortness of breath, decreased appetite, urinary tract infections, vomiting. The most common side effects of Jemperli when used alone include tiredness and weakness, low red blood cell count, anemia, diarrhea, nausea, constipation, vomiting. These are not all of the possible side effects of Jemperli. Call your doctor for medical advice about side effects.
You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/MedWatch or call 1-800-FDA-1088. You may also report negative side effects to GSK at www.gsk.public.reportem.com or 1-888-825-5249. Please see full prescribing information, including medication guide for patients, on this page or at Jemperli.com.